I did not have any reaction to the press conference when the president spoke after William Bryan, I think his name is, and when he started talking about perhaps we should be studying if there are any ways of treating the body with ultraviolet light, or the ingredients in disinfectants, have some studies to see if it's something that can be used for treatment of coronavirus. When I saw the media reaction to what he said, saying that he was in essence telling people to inject themselves with Clorox or to ingest Lysol, I went back to the transcript because I had no reaction to when the president spoke. And in fact, I did not see in the transcript where he said anything of the sort. He was talking to Mr. Bryan about, doing studies to find out if there are ways of doing this. And I did not have a reaction, perhaps because I've heard of treatments like that in the past. I had breast cancer some years ago, and I had little kids at the time. And so when they asked me if I wanted to be the subject of different experimental therapies and diagnostic tests, I said absolutely. One of them involved, and I'm sorry for being graphic, but involved me being topless and put my breasts inside a vat of milk where they had UV light being shot from the sides. So I've heard of things like this. But I went back to make sure, I'm not being like crazy. And I went back, and it took a 5-second Google search to find out, have therapies like these being considered in the past. And I intentionally looked for things that were published before 2020. This is what I found. August 2012, Tokai University School of Medicine. This is in Japan. New cancer therapy using ultraviolet C, UVC pulse flash irradiation. Ito and colleagues plan to develop this system compatible for cancer treatment using endoscopy, laser microscopy, and other such light irradiation equipment. Another patent, this one is from 2015, a device and method used proposed to enable treatment of interior bodily hollow organs and other interior cavities of the body for a number of harmful virus, fungal, bacterial entities, and autoimmune conditions by internal short wavelength ultraviolet light by use of specifically equipped endoscope-like devices. Another patent, internal ultraviolet therapy. Here the inventor developed a system for emission of therapeutic doses of UV light via catheter, capsule, endoscope, tube or port that can be used to manage internal infections and inflammatory conditions inside the patient. And then it mentions about internal light therapy to treat conditions affecting the lungs, such as pneumonia.
So I ask Bill a question that probably some of you are thinking of if you're totally into that world, which I find to be very interesting. So supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting.
Now, about the Clorox, 2011 study of hypochlorous acid, and this study says that the acid was stable and is highly microbicidal, active against bacteria, viruses, and fungi. All the patients became free of pain. Adverse effects were not reported. 2016, hypochlorous acid is a highly reactive oxidant that oxidizes methionines, tyrosines, and other amino acids and proteins, killing the microbe. 2018, a study in a university in Germany. The immune cells douse the bacteria with a toxic cocktail that contains, among other things, chlorine bleach. This leads to the oxidation of proteins inside the bacterial cell within seconds, resulting in bacterial death.
And then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number in the lungs. So it'd be interesting to check that. So that you're going to have to use medical doctors with. But it sounds interesting.
Now, again, I didn't have any reaction to this. But this is how the media portrayed it, and this is not what people believe.
And now you have the president telling people, well, maybe we should take, bleach or something, those disinfectants to treat this.
A serious problem when the President of the United States talks about something that is poisonous, which is ingesting Lysol or another disinfectant.
But it just seems wildly irresponsible for the President of the United States to be musing out loud about people injecting disinfectant, used bleach and other disinfectants used to kill viruses on surfaces in your kitchen.
They waited 12 hours before the new press secretary put out a statement, which essentially just blamed the media, said that we were taking the president's comments out of context, which we know that we weren't, which we know that we weren't, which we know that we weren't.